Hello and welcome to this presentation on nutritional immunology. My name is Jessica Flutter and I am so glad that you have decided to join me. We are going to be breaking up this presentation into 3 sections. The first one is going to be the introduction as well as vitamins. The second one is going to be on minerals and then phytochemicals. And then we will wrap up with the third section on food safety. So let's begin with nutritional immunology. The goal of this presentation is seeing how we can let our food fight for us. Here are a couple of the objectives that we'll go through throughout this presentation. The first one is to realize the link between our nutrition and our immune system. We also want to understand the importance of plant-based foods to our immunity. This includes vitamins, minerals, and phytochemicals because they are richest when it comes to plant-based foods. In our third section, we will learn food safety guidelines that will help prevent infection. So what's sort of a working definition of nutritional immunology? Well, it's the study of dietary components in the foods that we eat as they relate to the immune system and its response to foreign substances. These can be things like viruses, bacteria, and toxins. So let's see kind of how this topic of nutritional immunology began. In 1810, we have what's considered the birth of nutritional immunology. This began when we found that lymphoid tissue, which is responsible for helping your immune system, began to decrease when patients were malnourished. So that's where we found the first link between our immune system and our nutrition. Then in the early 1900s, we come to the vitamin era. This is where the discovery of vitamins began. During this time, one of the first vitamins that was discovered was thiamine, and this is where we first got the term vitamin. Also, there was a very important text that kind of had its peak during this time, and it was called Natural Resistance in Clinical Medicine. In this particular text, we saw how our immune system provided that natural resistance and how our nutrition can play a role. Then moving on to World War II, we see the antibiotic era, and really the vitamins took a backseat during this time. The antibiotic era really had a huge discovery with the penicillin in 1929, and vitamins just were not as prevalent when it came to research studies. But then in the 60s and 70s, we did have this rebirth of looking at vitamins and how they play a role in our immune system and infection. The resurgence was really with several research studies that were being conducted in over 25 countries in the world. These types of studies were really focusing on protein energy malnutrition as well as iron deficiency and those effects on the immune system. Then in the 1980s, we had several conferences, workshops, as well as books that were being written on this topic. In addition, there was a group that was formed called the International Nutrition Immunology Group. Then in 1991, a journal was created about this topic called Journal of Nutritional Immunology. Now, what's important about having a journal in your field is that it kind of lets everyone know maybe the research that is being conducted in that topic. One of the studies that was done was called Immunocompetence in Undernutrition back in 1993. This study examined 90 malnourished children to see how undernutrition affected their immune system. They did find that their immune response to infection was significantly reduced because they were malnourished. And presently there are several ongoing research studies in this field because we definitely have a lot to learn. And also there are internet websites and blogs that you can look at, but I really want to encourage you about the importance of critically evaluating those websites. If you're looking up information online, please know that websites that end in .edu or .gov are the most credible because they either are a university who's sponsoring them or the government. Also, one of the very helpful websites I found was the Office of Dietary Supplements. This is a website that is put on by the National Institutes of Health, and the goal of it is really to widen our understanding of dietary supplements through scientific information. But one thing to remember is that the Food and Drug Administration does not regulate supplements. So, as far as the labels of supplements, that could be as much as a 50% discrepancy of what you're really receiving. So that's something to keep in mind, that we're going to focus on receiving all of these vitamins, minerals, and phytochemicals through the foods that we eat rather than supplements. So how can we link the two? How can we see how nutrition is related to our immunology? Well, immune cells, just like every other cell in your body, needs nutrients to grow and function. And we do know that the food that we eat provides those nutrients. Now, we may be familiar with calories and protein, but maybe something we're not as familiar with are the vitamins and minerals in the foods that we eat and how they can play a role in our health. We do know that poor nutrition makes it more difficult to fight off germs. So we're going to focus on the importance of plant-based foods. This is because our typical American diet usually has plenty of animal sources. Plant-based foods, though, are great sources of vitamins, minerals, and phytochemicals. But before we dive into those, let's look a little bit more at our immune system. So let's have a little bit of Immune System 101. Well, our immune system is made up of cells, tissues, and organs that defend the body against foreign invaders. These invaders can be anything like bacteria, viruses, parasites, or toxins. Now, your bone marrow, which is the soft tissue part in your bone, is really responsible for producing all of the blood cells in your body. And we're going to focus on the white blood cells. Another name for white blood cells are lymphocytes, but they are our major immune cell when it comes to fighting off infection. I'd like us to think of our white blood cells, if we can, as our local friendly cop. Just as cops kind of patrol the highways to keep people safe, white blood cells do the same. They patrol our blood vessels and our lymphatic vessels, and they're going to be looking for foreign invaders, those bacteria, viruses, and parasites and toxins that could cause an infection. There are several types of white blood cells that we have in our body. One of them are T cells, and they mature in the thymus. The thymus is located right behind the sternum, and it's in front of your heart. The T cells are made up of helper T cells. Helper T cells just help your cells communicate best with each other. There's also cytotoxic T cells and natural killer cells. These do exactly what their name implies. They attack those foreign invaders so that they will be less likely to prevent infection. There are also B cells, which mature in plasma cells. B cells are responsible for producing the antibodies. Antibodies are great because they attach to those foreign invaders and pretty much signal the rest of your cells that the foreign invader has made it into your body so that those cells can come and attack and hopefully kill. Another organ that's important in our immune system is the spleen. The spleen is the meeting ground for immune cells so they can best do their work. And it is a flattened organ that's in the upper left part of your abdomen. What makes the immune system so effective is its communication network. Our first line of defense when it comes to any kind of microorganism or foreign invader are barriers. These barriers include our skin, our nose, our stomach, and our mucous membranes. Now, your skin prevents microorganisms from entering into the inside of your body. Your nose is responsible for kind of cleaning out the air that you breathe so that hopefully no toxins will enter through into your body. The stomach is responsible for really neutralizing any of that food that comes in that may have the potential to have bacteria in it. The acid in it is what will hopefully neutralize that bacteria. And mucous membranes also work throughout your body so that they will prevent those microorganisms from coming in. B cells, as we talked about earlier, do have those antibodies that help the rest of the cells communicate with each other. And then there's the T cells. The helper, cytotoxic, and natural killer cells all have to work together so that they can be the best effective team to fight that microorganism. And finally, we have phagocytes. These are very large cells that swallow and digest foreign substances or invaders. So what's the critical point when it comes to maybe undergoing cancer treatment? Well, treatments lower the number of white blood cells. That means that we may not be as able to defend our bodies against infection. When those low number of white blood cells happen, it could result in neutropenia. Neutropenia is an abnormally low count of neutrophils, and neutrophils are just a type of white blood cell. In adults, neutropenia is generally defined as having less than 1,700 neutrophils per microliter of blood, and that may be something that you could ask your doctor about. If it's severe, that would be having less than 500 neutrophils per microliter of blood. Now at that point, you may be placed on what's called a neutropenic diet. This type of diet is going to help try to protect you from the bacteria that's found in some foods and drinks. And this diet will focus on avoiding foods like raw, fresh fruits and vegetables, as well as the importance of cooking foods, for example, ground beef, all the way to destroy that bacteria. One of the treatments that we'll look at is surgery. Surgery suppresses or kind of decreases the ability of your immune system to work effectively. We know that with surgery, our skin and mucus barrier is broken, so that first line of defense has been compromised. But keep in mind that recovery from surgery is individualized. For some, it may be a couple weeks, but for others, their immune system may be suppressed for a couple months. Another treatment that is very common is chemotherapy, and it also suppresses the immune system. Specifically, chemotherapy can cause an insufficient production of blood cells, and white blood cells happen to be the most sensitive to this type of therapy. This insufficient production of blood cells is also called myelosuppression, and I've listed a couple of chemotherapy drugs that cause that suppression: carboplatin, cisplatin, docetaxel, and 5-FU. All can cause a mild to severe suppression. But keep in mind that just like surgery, effect is individualized. Another type of cancer treatment is radiation therapy. Radiation therapy targets rapidly growing cells, and guess what? Our blood cells are rapidly growing, so it is going to target those white blood cells. Also, the GI tract or your digestive tract has rapidly growing cells as well. If these get damaged by the radiation therapy, you may not be able to resist as well the bacteria that's in the food that you eat. Also, during radiation therapy, the skin and mucous membranes may be damaged, again, which means that it could be easier for those microorganisms to enter the body and cause infection. The final treatment that we'll look at is immunotherapy. This uses the immune response to treat the cancer tumor growth. The goal of this type of therapy is to improve your immune system's ability to kill cancer cells. However, since we're kind of messing with your immune system, it may interfere with your body's natural resistance against infection, which could cause a problem. So what can we do? Well, we can give ourselves a boost, and we can strengthen that immune function through the foods that we eat. Primarily, we're going to look at the role of vitamins, minerals, and phytochemicals in the foods that we eat. Now, it's important to obtain these nutrients in foods rather than supplements, and I'll give you an example. There was a study that was being conducted on patients who had lung cancer, and they were giving supplements of a type of vitamin A. But the study was stopped after researchers discovered that subjects receiving that vitamin A had a 46% higher risk of dying from lung cancer. So sometimes we don't know what levels are appropriate when it comes to supplements. But we do know that the vitamins and minerals and phytochemicals are safe in the foods that we eat. That's why we're going to focus on having a colorful array and a huge variety of fruits and vegetables and whole grains to get those adequate dietary components. So let's begin by looking at some vitamins and how they can help our immune system. Vitamin A is an antioxidant. An antioxidant is anything that prevents the oxidation in your body that can damage cells, so this is helpful. Some immune benefits of vitamin A is that it promotes healthy surface linings. These linings are like your respiratory, urinary, or intestinal tract. so the bacteria cannot enter your body as easily and cause infection. Also, vitamin A may increase the effectiveness of white blood cells so that they can fight off infection. Some foods that are higher in vitamin A include carrots, spinach, kale, which you'll see in that picture, cantaloupe, sweet potatoes, whole milk, whole eggs, and liver. Now the thing is, you may wonder why whole milk is listed instead of maybe a more lower fat milk. Well, since vitamin A is a fat-soluble vitamin, it is best absorbed with some fat. That's why whole milk is listed here. However, non-fat milk and 2% milk do have vitamin A fortified back into them. The next vitamin that we'll take a look at for its immune benefits is vitamin C, or you may know it as ascorbic acid. It also acts as an antioxidant to help prevent that damage to your cells. But the thing with vitamin C is that we have to obtain it through food sources because our body doesn't make it. That's why it's called an essential vitamin. And also, it's important to note that the vitamin C in foods can decrease. Air exposure destroys vitamin C as well as heat. A couple of the immune benefits of vitamin C include wound healing. This promotes that skin barrier so that it's less having a likely chance of the risk of having infection. It also enhances the function of immune cells, and it's highest in white blood cells, eyes, certain glands, and your brain compared to other cells. Also, vitamin C improves the absorption of iron, which is a very helpful mineral that we'll look at for its immune benefits a little bit later. Some of the foods that are high in vitamin C include red and green peppers, citrus fruits, kiwi, strawberries, and broccoli. So we'll want to focus on these foods if we want vitamin C. But keep in mind when we're looking at those citrus fruits that one fruit in particular could cause a problem. Grapefruit or grapefruit juice does have a component in it that may negatively interact with your medication. So it's important not to consume this if you are on any type of medication. Vitamin E also acts as an antioxidant for your body. One of its immune benefits is that it enhances immune activity so that your immune system will work better at fighting off infection. Vitamin E also aids in the production of antibodies, those signals that can help tell the rest of your immune system that a microorganism has entered the body. Some of the foods that are high in vitamin E that you would want to include in your diet to help would be nuts like almonds, hazelnuts, which you see a picture there, as well as peanuts. Other foods include seeds and vegetable oils that you may use when you cook your food. Vitamin B6 is the next one that we'll look at for your immune function. Its main function is with our metabolism, but we've also found a link with immunity. Though deficiency is unlikely with this particular vitamin, low intake of it has been associated with an impaired immune function. Also, those who have a deficiency have a decreased white blood cell production as well as a decreased interleukin-2 production. Interleukin-2 is a very important immune system protein, and it helps your immune cells to communicate. So it's critical that we would have this type of protein functioning as best as it could, and vitamin B6 may play a role in that. Some of the foods that you'll see listed there are high in vitamin 6. This includes fortified cereal, bananas, potatoes, spinach, hazelnuts, and then your animal-based sides, salmon, chicken, and turkey. The final vitamin that we'll look at in this section is vitamin D. Its primary function is working with the metabolism of calcium. It helps your body absorb calcium so that you can store it in your bones. One of its immune benefits is that it enhances the immune system, although that's a pretty general statement and the exact way it does this is unknown. Also, vitamin D may help inhibit the development of autoimmunity. Autoimmunity is when your own immune system attacks the healthy cells in your body. So obviously we would want to inhibit this as much as possible. Finally, vitamin D is a receptor on most of our immune cells. Therefore, it's very important that we would have it in the foods that we eat so that it can help our immune cells communicate the best that they can. One interesting thing to note about vitamin D is that it's not only given through foods. We also can receive it through sunlight. In fact, what happens is when sunlight reaches your skin can actually transfer that sunlight into vitamin D. But again, we want to focus on foods. Foods include salmon, sardines, and mackerel. Those are your fish that are high in vitamin D, as well as fortified milk and fortified cereal, where vitamin D has actually been added back into the product. So that was your introduction and your vitamins when it comes to nutritional immunology. I hope you'll join me for the next section, which looks at how minerals and phytochemicals can help us when it comes to defending our bodies.